Hello, how are you guys? How are you doing? It's your sister Roslyn once again. Welcome you to my YouTube channel, guys. And this morning, it's not about even morning, it's evening. This evening, guys, I want to tell you about the progress of my feet. My feet are still swollen, still painful. It's because we are in winter now. During cold season, I do have a lot of pains, but trust God. Itaisha too. I went to the hospital like 2 days ago. And still, as usual, the doctor didn't give me any best reason why they are swollen, why they are paining, why they never told me anything tangible, anything. Okay, and I remember also in 2018 or 2017, thereby I went to the hospital for the same. And they told me nothing more about it, nothing tangible. It was only just keep them warm. Kwani mtoto, keep them warm, make sure ukanyagi maji nini blah blah. Okay, ni sawa. And that brings me to the topic of today, guys. Have you ever gone to the hospital knowing very well unaendea maybe unaumwa na kichwa? Ukifika huko hosi kenye unaambiwa ai hatu nashtuka. And that was my life in 2015 or there. In my whole life, okay, since I was 10, I think 10, 12 hapo, I was having complication ya tumbo. So one day my mom decided, when I was in form 2 or form 1, we decided to go to hospital Nairobi X-ray center to do an X-ray. So after the burial meal, and I was taken for the X-ray, and they said I have duodenal ulcers. So since then nilikuwa natumia Actols, antacid that is. So after some times I upgraded, call it upgrading. Yes, I upgraded to this omeprazole. Yeah, because I usually know whenever I have complication ni ulcers tu. Mi hakuna ugonjwa ingine na nisumbua, ni ulcers. So when I came abroad in 2014, I told my boss about it, and she was like, okay. So since I was working in the hospital, I used to take omeprazole every now and then. I am having pain, I just take omeprazole. So it reached an extent that it was now worse. So I started puking blood. By then we were in Abu Dhabi. That day I remember, because as I told you in my previous video, my boss used to travel a lot. Kaenda, Rose, let's go. We couldn't stay in a country for more than 3 months. No. Tukikaa sana ni 3 months. Rose, let's go. So that was our life with my former boss. That was my Saudi boss. We used to travel a lot, from Abu Dhabi to Qatar to Dubai to Saudi to Australia to wherever. She was a very good woman, by the way. Tulikuwa tunaenda, but since she's my boss, me I don't care. She will pay everything. So this time round I was in pain, and I told her I took my omeprazole as usual. It wasn't the matter, I started puking blood. Kumbe the wounds were bleeding, and the following day we were supposed to cross to Dubai. We were already in Abu Dhabi. We were supposed to cross to Dubai. So this time round I took omeprazole as usual, puking blood. And when we reached Dubai, the following day we went to the hospital. Me, I knew I had ulcers. So the doctors did whatever they had to do. They checked, they did the endoscopy and everything, and they told me, yes, you have bleeding ulcers, but we have to check more. So we went through a lot of procedures, X-ray, here in these developed countries, what after wakuchambue mwili yote. So after kuchambua ring, they came back and told me, well, you have duodenal ulcers, it's now bleeding and we can't give you any dawa. No, it won't help you. Maybe we give you dawa for 2 months, then it will be back again. So the best thing, kwenda theater. We go do away with this thing once and for all. And I was like, okay. So they went and they came back with another doctor. When they went and came back, they told me I need to go for another CT scan. So I went for the CT scan. They did whatever. Then in the evening, I was admitted for almost 2 weeks. Remember, my family back home, they don't know. They know nothing. So after the CT scan and everything, I came back in the ward, stayed there. And you know, these people's wards, it's not congested like Bagathi and everything. Maybe you are 2 of you in the ward or you are just alone. So my ward, I was alone with the nurse. So after 2 days, I'm here in the ward. They came back again and told me, no, we need to do another x-ray. Why? Because we think you are having complication also with your kidney. Was I ready for that kidney thing? I wasn't ready, but it's okay. Let's go. Let's do. So we went and do the kidney thing, and they came back and told me my kidney has complication also. Okay. And they told me they are going to do everything there in theater because the kidney, there is what term did they use? I can't remember the term that doctor used it. He was an Egyptian doctor. I can't remember what he told me, but he told me the lining of the kidney, the outer lining of the kidney, there is a part he has to do away with it because it's infected. Okay. Ni sawa, but I had a very, very good madam, by the way. She was always there in the hospital. For those 2 weeks I was in the hospital, daily. She would come, daily she was there. Daily. Remember, my people home, they don't know anything. So I told him, it's okay, it's fine. And he told me it's just a procedure for 2 hours or less. Okay. I was prepared for the following day for the theater, for the surgery. The following day we went for the surgery. It wasn't the matter or the shock on me. I'm there in the waiting area of the theater. I'm there, I'm wheeled there. I'm waiting for my turn. Then another doctor came in. Not the surgeon, another doctor came in and told me, have you ever known you have sickle cell traces? I'm like, what are you saying? What is sickle cell traces and what is that? Okay, always read or know. There are sickle cell disease, sickle cell whatever. There are sickle cell SS patients, but I never knew I can be among them. What is that? Then he told me, yes, you have traces, and since we don't know if it's active or dormant, you have to go back to the wards. We take you to the lab again and check. Remember, I'm here in the waiting room for the theater. I'm next after the other patient. I'm next. I'm wheeled again now to the ward. That was the longest time of my life. I'm just trying. My mind is everywhere. Nashindwa. Sickle cell na mimi. In my family, I've never had such a thing, and it's genetic. And in my family, nothing like that. Kwani nimeikunywa kwa maji. Now the doctors came in the ward, trying to explaining to me what is this sickle cell, how did I and everything, and I'm like, what? So they told me they can't take me to the theater. I can't do that surgery because they don't know if the traces they're what, dormant, or they're reactive. And if they are reactive up to which point. So lazima they know everything before I'm taken for the surgery. So now I'm taken back to their labs. They come back again after a day. They told me, now we have known you have sickle cell traces, but they are dormant. They are dormant. They are not reactive. In that case, we can take you for the surgery. So I'm prepared again for the surgery for the following day. That's when I went in the theater and they rectified everything. The ulcers and the kidney problem and everything. Remember, this time round, I'm just there wondering. I came here for ulcers. You guys were telling me a lot of complications. Ma anbenda kiaga takamugole gigo. Where did you get all these things from? Hmm? You know, like here in developed countries, when you go to the hospital for eyes, maybe for the eye checkup, like in my country, umeenda huko unaumwa na macho, hiyo macho ndio watashughulika nayo, hizo maneno zingine ni zako. But here no, you come to the hospital, they want to check you. The ENT doctor is there, the whoever doctor is there, the whoever the gyna is there, the psychologist is there, the therapist is there, the kiango is, yani umesaraundiwa ni kama we ni maiti mpaka unaanza kushtuka. Haya, kwani naota? Because everyone now is in white and they surround your bed and you're like, well, wait a minute, what is not happening? So so I stayed in the hospital for 2 weeks. Then I came back. Yeah, I came back in the hotel. We were having a hotel. We stayed there because I was still going for my clinics. I went for my clinics there. Then after 3 weeks, we traveled again. We were going to Kuwait. This time round, we were not going for leisure. We were going to work. For work in Kuwait. So we stayed in Kuwait for another 3 months. And we went back to Australia. That was in 2016, 2017 hapo. Yeah, 2016, 17 hapo. We traveled back to Australia. Then after a short period, we came back to Dubai. So that's how my medical journey was. And my question was, you as a person, have you ever gone to the hospital for one reason? Then ukifika huko zile mamoshene unapewa sasa, hey, hatu nashindwa hizi sasa zimetokea wapi? You are not ready for all this. It was not in your cup of tea. You can imagine umeenda hosi unaumwa na kichwa. Sasa unaanza kuambiwa, hata hii mguu yako inakuuma, hata hii mkono sijui nini. Have you ever been in that situation? How was your reaction? Me, I had a lot of mixed reactions, by the way. Especially wakati sawa walifika at sijui I have a kidney problem, and I'm like, okay, now you have sickle cell, sijui anemia, sijui kiango, sijui. I stayed the whole night googling what is this sickle cell anemia, how can it end, and all that. So it really disturbed me. But we thank God, mine was dormant. So the doctor told me it means our parents, they were carriers. That's why I was having. And in my family, which means that lineage, it means at some point we shall have an active sickle cell anemic baby. But we rebuke that in the name of Jesus. We are not ready for that. We rebuke it. So guys, tell me down there in the comment section, have you ever been in that situation? How did you handle it? And until next time, bye bye.